challenge we face in continually improving the health and well-being of all people in the communities we serve has never been greater. A team in Oshkosh has been working to develop a new patient-focused primary care delivery model to meet that challenge. Called the Affinity Medical Home, it's setting new standards for quality care and is providing ministry with pioneering experience with some of the concepts of healthcare reform.
When I was first introduced to the idea of the medical home, my thought was, wow, this is the way healthcare is supposed to be. This is the way it's always supposed to be. In a perfect world, this would be healthcare.
I knew it would be hard. It was going to be a complete change from what we were doing previous in terms of offering our care.
We had approximately 9 committees to start out with that were setting up all the different policies and training programs, etc. And downstairs, what you would see on the walls with everything up there mapped out how things were going to happen, what's down there now is truly nothing compared to what it used to be. It was probably 4 times as much of this, but as much of all this paperwork there was, it all came down to taking everything and finding out where the mistakes were, where the stuff was that we could cut out that we didn't need to do, and yet still end up with a superior product. I think probably the biggest and most important thing that we did was really taking and embracing the concept of a team that really works together.
Dr. Kramer?
Hello.
Hi.
It's not just me as a physician with my nurse seeing my patients. It is literally a team of healthcare associates, patient service reps, nurse practitioners, RN specialists, behavioral health social worker, and myself as the lead physician in our department, working collectively, much more efficiently, much more leanly to provide better medical care.
When a patient calls and asks to speak to Dr. Kramer's nurse, I say, I am Dr. Kramer's nurse, and they'll say, well, I spoke with Marcy yesterday, or I spoke with Lori yesterday, and then we do explain to them that, we work together, and we are all Dr. Kramer's nurses, and we're all here to help you with whatever you need. Sometimes it is hard for patients to get used to, but once they've come in contact with us and speak with us, they understand that we are here to help them.
I always tell our patients when they come here for the first time, welcome home. This is your new home for your healthcare needs. And then I explain to them what a medical home is, that it's increased time, it's increased personalized care for them. We research things, we don't repeat tests. If a different doctor orders a cholesterol panel, we'll use that cholesterol panel if it's within a good time frame. We also will give them their test results so they have a copy to take to outside places. We want to help them make their healthcare more efficient.
They have more time with the doctor now, too, with the provider, because we can do the rooming and we are able to take more questions and more information from the patient, and the nurses can do a little more, too. They take more information so that when the provider finally comes in,
they're there to deal with the problem, and that's it.
When I first came here, we were getting patient complaints every day about access and about things like that, and we've increased the access and decreased the patient complaints.
Our patients are so different than they were a little over a year ago. They would come in upset because this didn't happen or that didn't happen.
And the returning of the phone calls, because we do have that nurse of the day.
Rachel, I have a patient on the phone.
When a patient calls and says, this medication's not working for me, what can I do?
Hi, this is Rachel.
Before we had the nurse of the day, patients weren't getting their phone calls back until the next day, possibly. Now it's within 2 hours.
Ultimately, it's better patient care for all of our patients, not the ones that are just in the office, but the ones that are calling in too.
And I hear comments frequently like, I love the fact that you listen to me. I love the fact that you take the time. And then they'll pat my hand as they're going out and say things like, thanks for listening, thanks for returning my phone call. It meant a lot to me that you knew this was going on with my husband and that you took care of him. And so many people are coming back to and saying, I'm telling everybody to come to you. I'm telling everybody they got to come here. And that's a pretty neat thing to hear.
We can't do it the way we were doing it years ago because it just doesn't work that way anymore. And actually, this works better.
I've worked with a lot of teams over the years, and I've never worked with a team of professionals like this, that I'm so proud of each and every one of them. It's an amazing group of people to work with, and I plan to be here for a long time.
We good, guys?
We're good.
All right, let's go rock it.
Go team!